Hi, I'm Ashley, and I have been an occupational therapist at a rehabilitation hospital for the past 10 years, working with individuals with a spinal cord injury. A lot of research has been done on stretching, and the occupational therapist is a skilled professional educated in stretching the upper body. Research has shown that consistent stretching increases muscle strength, decreases pain, and prevents injuries in the body. Performing a daily stretching program is recommended for individuals with a spinal cord injury for prevention of contractures, to improve blood flow to the muscle, to diminish spasticity, and to improve overall joint health. So I'm hoping that with this video that you as the caregiver at home will feel more comfortable and more confident in performing a home stretching program on your client or loved one. After watching this video, you should be able to remember the stretches of the shoulder blade, the arm, and the hand. You should be able to understand how to perform the stretches of the upper body, and you should know how to modify your stretching program if your client has shoulder subluxation. Before we get started, there are a few things that you should know about stretching the upper body. First, do the stretches every day or as often as directed by your occupational therapist. You should always begin by stretching the shoulder blade first and then the shoulder. Move the person slowly, gently, and smoothly. Avoid rapid or jerky motions. Each joint should be moved as far as it will go. Move each joint to the point where you feel some resistance. The person may feel discomfort, but do not push until the point that it hurts. Hold the position for 10 seconds. Return the person to the resting position and repeat this pattern 3 times. And always stretch both sides of the body. Ideally, stretching of the upper body is performed with your client or loved one in a lying down position. At home, you could use a bed or a mat table if you had one, but this position allows your client to be as relaxed as possible. However, for the purpose of this video, I'm going to demonstrate a stretching program on a client in a seated position so that you have a better image of my hand placement. So, now that you've understood a little bit more about stretching, let's get started. I will begin a stretching program on the shoulder blade. First, I'm going to cup the shoulder blade with my fingers. Here's the border of the shoulder blade closest to the spine. I'm going to cup my fingers here. I'm going to pull the shoulder blade towards the armpit. I'm then going to use the heel of my hand and I'm going to push the shoulder blade back into the spine. I'm going to continue this gliding motion inward and outward. I'm then going to rotate my hand so that my fingers are pointing downward. I'm going to grab the bottom or the inferior angle of the scapula or the shoulder blade. I'm going to cut my fingers there. I'm going to pull the shoulder blade up towards the ear. I'm then going to use the heel of my hand and I'm going to push the shoulder blade down towards the hip. Now I'm doing a gliding in an upward and a downward direction. Next, I'm going to cup the shoulder joint with one hand in front of the shoulder, one hand on the back of the shoulder. I'm going to do a backward shoulder circle. It's preferred never to do a forward shoulder circle to prevent forward posture, that bending forward that some clients already have. And lastly, I'm going to place one hand on the top of the shoulder and the other hand on top, and I'm going to push the shoulder blade, or this upper trapezius here, I'm going to push that down towards the hip firmly, and I'm going to hold for 30 seconds. This is the only stretch that you do one time and hold for 30 seconds. All of the other stretches of the upper arm will be performed 3 times for a 10-second hold. Now, I encourage you to pause your screen and repeat this stretch until you've got it. I encourage you to do this after each muscle group of stretching program. Before stretching the shoulder, it is important to check to see if the person that you are stretching has shoulder subluxation. Shoulder subluxation or shoulder instability is a mechanical integrity of the joint and is common in higher level spinal cord injuries. It occurs when the shoulder partially dislocates. If shoulder subluxation is present, there will be a gap or a separation in the shoulder joint right here. Sometimes you can even place a finger's width in that gap. If this is present on your client, first push the upper arm into the shoulder joint. If you can diminish that gap or get rid of it and improve that shoulder subluxation, then you can proceed the stretching program by holding the shoulder in this position. So if I was going to do my first stretch, I'm going to push the arm bone into the shoulder joint and then proceed by stretching upward. This is called joint approximation. If I am unable to correct that shoulder subluxation by doing that pressure into the shoulder joint, then we might need something more like an electrical stimulation protocol. What that's going to do is you're going to place one electrode here on top of the shoulder blade and the second electrode on the posterior deltoid or the back of the arm. This program can be issued to you by your occupational therapist. If you do not have an electrical stimulation device available to you, then you can perform the arm stretches to 90 degrees. So holding here and stopping. Do not proceed by going overhead. It is not safe for the shoulder joint. So now that you understand shoulder subluxation, we're going to proceed the stretching program on someone that does not have shoulder subluxation present. So we're first going to begin, we've done the shoulder blade now, we're next going to move on to the shoulder. I'm going to cup the wrist joint and I'm going to cup the elbow joint. The thumb should always be pointed upward towards the ceiling. This is going to put the shoulder in the most natural position. I'm going to leave the arm nice and close to the ear and I'm going to stretch up overhead, leaving the elbow as straight or extended as possible. A common mistake here is for the caregiver to let the arm wing out to the side. If there's tightness here, your client may also want to do that position. The correct position, however, is with the thumb rotated backward and the arm nice and close to the ear. It's important that you hold this then for the 10-second duration and repeat 3 times. The next stretch is shoulder abduction. If you're sitting, it's as if you were doing a jumping jack. If you're laying down, it's as if you were doing a snow angel. Again, my hand placement is the same as the first stretch. I'm going to take the thumb upward, so the angle or the direction is always leading with the thumb. I'm supporting at the elbow, supporting at the wrist, and the arm is nice and straight or extended. Here, a common mistake is for people to come too far in front and not get into the correct position all the way out here to the side. And then up overhead until I feel a point of resistance. Stop and hold for 10 seconds. The next stretch, I'm going to again lead with the thumb. I'm going to hold at the wrist, hold at the elbow. I'm going to horizontally adduct the arm or cross the arm across the body. Again, the arm needs to be nice and straight. Sometimes the caregiver or the client will want to lower the arm down here, and the correct position is actually at this 90 degrees across the body. So I'm going to hold across the body, then I'm going to take the arm out and horizontally abduct the arm or take it past neutral and stretch this pectoralis muscle group here, keeping the arm nice and extended. Again, I'm noticing if there's any grimacing on my client's facial expressions or any discomfort. The next stretch is external rotation. It's as if your client is holding a waiter's tray. The shoulder's at a 90-degree angle, the elbow's at a 90-degree angle. I'm going to support at the wrist, support at the elbow, and I'm going to bring the hand back behind the client's head. Hold the stretch for 10 seconds, and then keep the elbow here so if it's a fulcrum. Drop the hand down as if they're putting their tips in their pocket. If there's any pain on this one, the capsule, sometimes if the capsule's tight, your client may complain of some discomfort here. You can drop the elbow to 45 degrees here and then stretch here. It's a little bit gentler on that shoulder joint. The next stretch is elbow flexion. I'm going to again keep my same positioning at the wrist and the elbow. I'm going to bring the hand up as if the client's doing a bicep curl. And then I'm going to extend the arm and hold. So now that we've done the shoulder blade, the shoulder, and the elbow, we're going to now move on to the forearm and the wrist. So the next one is forearm supination and pronation, or simply palm up and palm down. This stretch is important to not torque on the wrist. This is actually a stretch of the forearm. So cup both sides of the hand and simply just rotate upward until you feel a point of resistance, and then downward until you feel a point of resistance. The next one is the fingers. You're going to take your thumb, put it over the middle knuckle here, and your fingertips under the fingers. You're going to hold the wrist neutral or straight. The wrist is not extended or flexed, but simply neutral or right in the center. I'm going to bring the fingers down 90 degrees as if they're making a flat roof here. Again, the wrist is nice and straight. I'm then going to extend the fingers up to a steep roof, and I'm going to alternate between those two, the flat roof and the steep roof. Next, I'm going to bend the knuckles. I'm going to flex as if I'm making a bear claw. I'm going to then extend the fingers up, and I'm going to do a long fist. I'm going to put my hand on the back of theirs, bring the fingertips all the way down to the palm of the hand. The difference between a long fist and a short fist is here's a short fist, here's a long fist. So I'll repeat that last one. So it's a steep roof, a bear claw, a steep roof, and a long fist. And that's one repetition. We'll do that 3 times. Steep roof, bear claw, steep roof, long fist. The last one is for the thumb. We're going to make the thumb into a C. So it's as if the thumb is directly under the pointer finger in front of the body, and we're stretching the web space here. So I'm going to take my hand, cup the thumb joint to keep it nice and safe, and guide it into this position as if it's making a C on the hand. Then I'm going to take the thumb, pull it out to the side as if I'm making an L. So I'm just really cupping this joint here to keep it safe. And I'm going to alternate between my thumb C and my thumb L. And again, I'll repeat that 3 times. Again, as a reminder, always stretch both sides of the body. Take it to the point of resistance, never pain. And make sure that your client is always comfortable and in a relaxed position. I hope that you found this video helpful as a caregiver at home, and I hope that you remember to do your stretches every day. If you ever have any complications or questions, you can always consult your occupational therapist. Thank you.